Yeah, I think it's a really important question, and there's two parts to that. So women are typically diagnosed at a later stage. So if you look at, all of the data, women tend to have more advanced disease. They're more likely to have invasive disease at the time of diagnosis than men. And then the second part of that is, even when you kind of adjust for all of those things and you say, okay, well, if you look at just stage for stage, do women have the same outcomes? They don't. Women, even when you look at the individual cancer stages, women still do worse. And I think the first part of the question is, why do women tend to get diagnosed later, or at a more advanced stage than men? And it's because they're diagnosed later. And because I think many of the times the symptoms, or the signs of bladder cancer tend to be missed. And for women, a lot of times it's because they say, oh, I have symptoms, I saw a little blood maybe, or I'm having burning when I pee, and it gets treated as a urinary tract infection. And so on average, women get diagnosed from the first symptom or sign that they noticed. There's about an 8-month delay to diagnosis, compared to men. So there's a pretty big lag where, bladder cancer is initially progressing, moving along, and it's not it hasn't been found yet. And then the second part, why do women tend to do worse? Or why do they do worse stage for stage? I think it is probably a biology reason, that we are starting to understand. But I think that when we really get into the biology of the cancer, there are different subtypes of bladder cancer, and that we're starting to understand. And it seems like women tend to have some of the more aggressive subtypes, compared to men. And whether there's a hormonal contribution, whether estrogen plays a role, we don't know. I mean, that's all very early in work, but people are definitely looking more at the science part, or the basic science part of that, to understand why women are still, again, doing worse, in terms of their prognosis at each stage. This is something, and this is something that is very, very important to me. And I think that when you look back at the time up to diagnosis, women in that time period up to diagnosis, which is really, it's like the critical time period, have been treated with antibiotics, like on average, at least 3 times, compared to men who've been treated, once. And so what I think that part of it is an education, component for physicians, and also for patients, that they really need to advocate for themselves. From a physician or a clinician standpoint, the way I think about it is, at least we have guidelines on seeing blood in the urine, and when should you refer. I really say everybody that has blood in their urine, if they see blood, they should be seen by a urologist, probably. It's really, even with a urinary tract infection, it's not that common to see true, like, well, the toilet's all red. And then from a clinician standpoint, women who have blood in their urine, you attribute it to a UTI, they should have another urine checked a couple weeks after you've treated them, to make sure there's not still blood in there, that there's not, microscopic hematuria. And I don't think that happens a lot of the time. And the other red flag, like when I'm talking to some of the, primary care docs in our community, and is that if they're not getting better, that's another red flag. Really, with a uncomplicated UTI patients, they should feel better within 24 hours of starting antibiotics. You should have a culture that shows that they're infected. And their symptoms, like, oh, it burns when I pee, and they shouldn't come back after the antibiotic stop. If they're not having like a period of symptom-free time in there, that's another red flag that really should prompt, like, maybe we need to look into this a little bit more. And I tell my patients the same thing. Every story from my female patients is the same. I, started having these symptoms last year. I never had a history of having UTIs. I was treated with antibiotics a couple of times, they didn't really seem to help. Like it would come back. And I had no idea that this wasn't normal. And a lot of times they are the ones that really pushed for further, like a further evaluation. And I tell them, hey, like, tell your friends, tell your family, like, if they're seeing blood, if they see blood, just tell them to really make sure they get that evaluated. And if all of a sudden they're getting these recurrent UTIs, again, ask for more evaluation.